Chronic disease and death from cardiovascular disease, stroke, type 2 diabetes, mental illness, and even some cancers have increased frighteningly among Americans, related to decreased physical activity and probably inappropriate nutrition.
American society stands at a critical juncture. Despite a number of advances in science, research, and education, we face a healthcare crisis characterized by poor nutrition, sedentary lifestyles, and subsequently, a staggering rise in chronic diseases. The far-reaching effects of this crisis could have a devastating impact on every facet of our culture. The American College of Sports Medicine, along with the Anthem Foundation, took action to address this crisis head-on. Together, the partners built upon a shared vision to improve the health of our nation and local communities by developing the ACSM American Fitness Index program. For more than 10 years, AFI has been helping cities, communities, and residents assess factors contributing to their community's level of fitness, health, and quality of life. With support from the Anthem Foundation, the American Fitness Index program has provided essential data metrics, strategic planning resources for communities, including a community action guide, and other helpful information for cities of all sizes.
The last 10 years with our partnership with Anthem Foundation has been phenomenal. We've been able to identify very specific things in the environment in each of our cities and these personal health habits, so that in the next 10 years, since we built this foundation, in the next 10 years, people can focus on their individual health habits, the percentage of the population who's obese, for example, and also what's happening in cities. In my own city of Atlanta, we've got now bike lanes that we've never seen before, only because we've set up this competition now between mayors of cities to make their cities more livable, more enjoyable, and allow people to be physically active when they want to be physically active.
With the awareness of AFI at the national level for rankings of states, the challenge is now in the cities to be able to form coalitions and inform the residents of things they can do to improve physical activity opportunities for people within their areas.
Civic and community leaders are at the center of the American Fitness Index strategy. By educating and equipping municipalities with customized data on key health indicators and resources that support physical activity, ACSM helps drive substantive change in policies and infrastructure that create fit-friendly communities.
When community leaders take advantage of the data summaries that are in the AFI report and mobilize their health promotion partners to impact the improvement priority areas, real change can be realized. And the My AFI Community Action Tool can extend the reach of the report by helping smaller cities gather the same type of data so that they can strive to implement meaningful strategies among their residents as well.
Medical professionals also play a key leadership role through individual health consultations with their patients and by serving as experts advocating for healthy policies in communities. Using the AFI data report, physicians can identify behavioral challenges within their communities and among patients, and encourage health-oriented decisions and actions that promote physical activity, fitness, and an improved quality of life.
I think physicians do have a role in promoting healthy lifestyles and particularly physically active lifestyles in their communities, and they can do so by being examples to their patients, to their staff, to their families, and to their communities by being physically active themselves. We know that you preach what you practice, and if we want our physicians to talk to their patients about physical activity, then they themselves have to be physically active.
Ultimately, through the American Fitness Index program, ACSM and the Anthem Foundation are working together to positively impact individual and community health and wellness. Residents can take an active role in helping shape a culture of health in their community by making healthy personal choices and being involved in local coalitions advocating for policies, making healthy choices the easy choice.
The American Fitness Index has a community action guide, which can help people who are really motivated to help their communities by role modeling and by advocating for opportunities for physical activity, to use the community action guide to help policymakers help their communities also become more physically active.
By investing more than $1 million over the last decade, the Anthem Foundation has enabled the American Fitness Index program to impact major metropolitan areas around the country, driving real and needed change that supports healthier communities and the people who live in them.
Over the years, we've been encouraged by the trends we've seen as a result of the 10 years of the American Fitness Index, whether that's a reduction in smoking rates, an increase in the number of farmers markets in our communities, or observing that our residents are biking or walking to work. All of these examples demonstrate that communities are embracing the results in this report and very much pursuing healthier lifestyles in their communities.
As the American Fitness Index program enters its second decade, ACSM and the Anthem Foundation remain committed to leading the way toward a brighter and healthier future for all Americans. To join the effort, visit us at AmericanFitnessIndex.org and follow us on social media. The ACSM American Fitness Index, actively moving America to better health.